Hi everyone, I'm Dr. Shweta Goswami, Medical Director, Zeeva Fertility. We're based out of Delhi and NCR. I wish to speak today about the various questions people have around the procedure known as IVF, which is in vitro fertilization, or commonly known as test tube baby. So, of course, one of the most common questions people ask and what they're worried about is how painful is the IVF procedure, how safe is the procedure. So, answering them one by one, IVF isn't as painful a procedure as people think it out to be. Also, over the years, a lot of injectables use has gone down, and therefore it's become less painful than it used to be. So there's just basically one important part of the IVF which is painful, and that is that we have to stimulate the ovaries to make multiple eggs, because the whole idea of IVF is to create multiple embryos. So as much as it pains the injections is the injection pain that one has to go through. So we have to be mentally ready that we would end up needing around 15 to 20 injections over a 2-week period. The injections are not extremely painful, they are as any injection would be, which means some of them are taken subcutaneous, so they are taken in the thigh, some of them are taken in the arms and buttocks, and you have a choice regarding them also, like which one of them do you prefer. Apart from that, the egg extraction process is done under anesthesia or sedation, and therefore it's not painful. The embryo transfer procedure or the implantation procedure is typically not a painful procedure, and for most people it's done without anesthesia. So IVF per se isn't a very painful procedure. Most women post embryo transfer implantation wouldn't even be on any injections. They would just be on some oral and probably vaginal medications. The second common question, as I said, is how safe is the procedure? Everybody is very worried, of course, and rightly so. Because of these hormones that are being given. But we have to go by scientific evidence and what has been as data accrued over the last more than 40 years, because IVF is now more than 40 years old science. And long-term data clearly suggests that there is no long-term increased risk to either the mother or the baby. The babies so born after IVF have been followed up over a long period of time now, more than 15-20 years. And it has been documented that they are as safe as an IVF, as a normal conception baby, especially when you compare it with an infertility population. So again, when the patient or the woman is undergoing injections, at that time you could see some temporary side effects like a little nausea, bloating, abdominal discomfort, constipation. Now these are symptoms people can have, but any painkillers or medicines can also be prescribed for the same. But those are short-term side effects. There are no long-term side effects of the treatment. And other than this, everybody is also very worried that how different is an IVF pregnancy from a natural pregnancy. Like if I conceive, is it always going to be a cesarean section? So again, nothing like that. Once the third month or the first trimester is over, you enter into your second trimester. There is absolutely no difference between the management of an IVF and a normal pregnancy, except for the fact that yes, it's an extremely precious pregnancy, so it has to be managed with care. These are, I think, 2-3 most important questions just to allay your anxiety that, of course, IVF is the end-all treatment for somebody who's been trying to conceive for a long time, or somebody who has absolute factors like a blocked fallopian tube or husband semen factors which are low. Those are the patients who end up needing an IVF sooner. But it's not as daunting a procedure as it probably turns out to be. So I would wish you all the best, and in case you need to undergo the procedure, please be rest assured it's not as painful as it seems, and it's quite safe. So take care and all the best.